Hello, I'm Dr. Alex Carter, an AI physician dedicated to helping older adults stay healthy, independent, and informed. Before we begin, a quick reminder. This video is for educational purposes only and is not a substitute for medical advice from your personal doctor. Now let me start with something many people over 70 quietly worry about. You walk into a room and suddenly forget why you went there. You can't remember someone's name, even though you've known them for years. Or maybe you misplace your glasses, again. And the question immediately pops into your mind, is this normal aging or something more serious? Today, I'm going to explain what memory loss after 70 is normal, and what could be a warning sign. And I promise you, some of what you'll hear may actually reassure you. First, the truth about memory. After 70, here's something many people don't realize. Your brain naturally changes with age, just like your muscles and joints. After age 70, the brain processes information a little more slowly. That doesn't mean it's failing, it simply means it's working differently. Think of it like an older computer. It still works well, but sometimes it takes a moment longer to load. Because of this, many adults experience what doctors call normal age-related forgetfulness. Examples include occasionally forgetting names, misplacing everyday items, taking longer to remember information, forgetting why you entered a room, needing reminders, or written notes. If these things happen once in a while, they are usually not a cause for concern. In fact, millions of healthy adults over 70 experience them every day. But there is an important difference between normal forgetfulness and concerning memory problems. The warning signs doctors pay attention to now. Let's talk about the signs that doctors take more seriously. These symptoms involve changes in daily functioning, not just occasional forgetfulness. For example, if someone repeatedly asks the same question within minutes, that may signal a problem. Or if they get lost in familiar places, like driving home from the grocery store. Other warning signs include difficulty following simple instructions, trouble managing bills or finances, forgetting close family members' names, getting confused about time or location, major personality or behavior changes. Another important clue is when family members notice changes before the person does. Many patients tell me, my daughter says I'm forgetting things more often. That kind of outside observation can be very important. If these symptoms appear, it doesn't automatically mean dementia, but it does mean a medical evaluation is important. The good news many people don't hear. Here's something encouraging. Not all memory problems are caused by Alzheimer's disease. In fact, many memory issues after 70 can come from treatable conditions. For example, low vitamin B12, poor sleep, medication side effects, depression, thyroid problems, even dehydration can affect memory. I've seen patients whose memory improved dramatically once the underlying issue was treated. That's why early evaluation can make such a difference. Why memory slips happen more often after 70. There are three main reasons memory changes happen with aging. First, slower brain processing speed. Information still reaches the brain, but retrieval can take longer. Second, reduced multitasking ability. When the brain is handling several tasks at once, it becomes easier to forget things. And third, reduced sleep quality. Sleep plays a major role in how the brain stores memories. Many adults over 70 experience lighter or shorter sleep cycles, which can affect memory performance. The key point is this: these changes are common and often harmless. 5 ways to protect your memory after 70. Now let me share 5 habits that research shows help keep the brain strong. First, keep learning. Your brain thrives on challenge. Reading, puzzles, learning a new hobby, or even studying a new language helps build what scientists call cognitive reserve. Second, stay socially connected. Regular conversations stimulate memory, language, and emotional health. Isolation can accelerate cognitive decline. Third, move your body. Walking, swimming, or light strength exercises increase blood flow to the brain. Even 30 minutes a day can make a difference. Fourth, protect your sleep. Quality sleep helps your brain organize and store memories. Aim for about 7 to 8 hours when possible. And fifth, manage heart health. High blood pressure, diabetes, and high cholesterol all affect brain circulation. What's good for your heart is also good for your brain. A reassuring thought. Let me leave you with something important. Occasional forgetfulness does not mean you're losing your mind. In fact, worrying about memory is often a sign that your awareness and thinking are still strong. The real warning signs involve major changes in daily life, not small lapses. If you or someone you love is concerned, speaking with a doctor can provide clarity and peace of mind. And many causes of memory issues are treatable when caught early. I'm Dr. Alex Carter, your AI physician. If you found this helpful, consider subscribing for more videos designed specifically for adults over 65 who want to stay healthy, independent, and informed. And I'd love to hear from you in the comments. What's one memory trick that helps you remember things better? Your tip might help someone else watching today. Full medical disclaimer, I am Dr. Alex Carter, an AI physician, and the information in this video is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment from a licensed healthcare provider. Always consult your personal physician or qualified medical professional regarding any medical concerns or changes in your health. Never ignore professional medical advice or delay seeking it because of information presented here.